Hey everybody, and welcome to another MDVIP Wellness Update. Just another in a series to try to get you as healthy as possible, but more importantly, keep you healthy. Tonight's topic, inflammation. Critically important. Stay around because in a few minutes I'm going to give you at least 5 ways that you can reduce the inflammation overload and hopefully avoid so many of the chronic problems that are afflicting so many of us today. You know, for years, physicists have been trying to discover the one underlying reason or underlying theory that just kind of binds together everything. In fact, that's what they called it. Stephen Hawking talked about trying to find that theory of everything. They haven't been able to really come up with that yet. And medical science actually is constantly looking for ways of explaining problems in as simple a way as possible. Well, we've come as close as we've ever come to identifying the holy grail of underlying problems in medicine, and that's inflammation. We're learning now that at its very core, the beginning domino of the dominoes that fall that create a lot of the chronic diseases is the inflammatory condition that we find ourselves in. If there is a single path that leads to the common underlying cause of so many of the problems that we experience in our wellness and our health, it's turning out to be inflammation. And that's why it's so important. And that's why I want to take a few minutes and explain a little bit about it. You know, the 4 horsemen of the medical apocalypse, if you will: coronary artery disease, diabetes, cancer, Alzheimer's, all seem to be riding the same horse: inflammation. And we've changed how we've thought about inflammation over the years. When I was in medical school, back when the earth was cooling, we thought inflammation was really predominantly a great thing. It was a way of protecting the body. It was a way of battling disease in many instances. But we've begun to reshape our thinking. We've begun to change the way we view inflammation and now actually respect it as more of a bane than a boon. And I'll get into exactly why. But more importantly, simple steps that you can take starting tonight, this evening, to reduce that inflammation overload that's really causing havoc in your cells. So what is it? Well, I mean, you hear the term all the time, especially in a COVID world. We're hearing inflammation constantly because a large component of the negative impact of COVID is due to the inflammatory response, due to inflammation. So what the heck is it? Well, it's the immune response. It's a part of our body's protective mechanism. It's a part of our response to an invader, whether it's bacteria, whether it's viruses, or whether it's products that are produced in our body that are considered toxins that trigger the same response that maybe a virus would, for example. It's a process that really depends on the little Pac-Man white blood cells in our bloodstream. They act like the little Pac-Man from the ancient video game, and they go around and they chew up all the bad guys. But they also produce a lot of chemicals in that process. They produce things like antibodies and cytokines, which are basically chemicals that trigger a whole cascade of events that lead to what we perceive as inflammation. You know, when you have some inflammation, you get redness of a joint, for example. Well, that redness is due to dilation of the blood vessels. Whenever you get an infection, it gets red and irritated. Well, that's simply dilating of the blood vessels due to these chemicals to feed more healing into that tissue. There's pain associated with it. That's where, because a lot of the chemicals produced again in the inflammatory response trigger the pain receptors. So there's this complex, incredibly interwoven amazingly difficult to understand web of interaction with the immune system, such that there's these checks and balances. The attempt is to provide just enough to help you get over whatever problem you have, but not too much, because overdoing it creates even more problems. And it's that overdoing that we've run into really big problems with when it comes to things like heart disease and diabetes and cancer and Alzheimer's. Chronic inflammation oftentimes stays below the radar. It's something that we, as physicians, don't always check. We have to do very specific blood tests if we're trying to measure the degree of inflammation in your system. And by the way, that's part of the blood work we'll do at the annual wellness exam, because we understand that inflammation, measuring that in an individual, is important in assessing their cardiovascular risk. This is Heart Health Month in February, and I promise that every time we get together, I'm going to be talking about something related to heart health, and nothing is more basic and paramount to heart health than the inflammatory response. Now, all of us, each of us, have some chronic inflammation. There's acute inflammation and chronic inflammation. Acute simply means the bacterial infection, the strep throat, or you get a cut on your finger. It's something that happens immediate. You call in the cavalry, they take care of the situation, and then they go on furlough. Chronic inflammation, which is really the bad guy, is where these same cells, these same immune cells, are activated for a number of reasons, and we'll talk about what those may be, but they don't go back into retirement. They stay deployed, if you will, and they're producing these chemicals that are creating these changes in your body's cells that lead to damage in your blood vessels, that lead to changes in the way your body produces certain hormones, that change the way the gut is able to provide a barrier from some of the bad nutrients that you take in. So it affects virtually every cell of the body. And there's some blood tests now that we can do that weren't even available 5 years ago that gives us a very good idea of your specific inflammatory state. But we also can make some determinations just by a physical exam or just by a history. But let's go down to the granular level. Let's get to where most people really want to be. You don't want to hear a lecture on physiology. You want to know, okay, I get it. Chronic inflammation is bad for me. It starts out and creates this domino effect that over a period of months to years leads to these bad things. Well, how can I reduce my own inflammation in my own system beginning today? Well, we always, like we should, start with nutrition. That's the fuel that we put in our gas tank that is absolutely the most vital component to wellness in many instances. The old garbage in, garbage out adage really applies to food. Specifically, as we think about nutrition, what are some things that we can do that provide anti-inflammatory mechanisms, if you will? And these are things like foods that contain a lot of omega-3 fatty acids. You've heard me talk about those in many instances. And these are largely things like fatty fish, salmon and tuna, cold water fatty fish. You even find a lot of that in tofu and walnuts, flax seeds and soybeans. Those are just some examples. Many people will do omega-3 fatty acid supplements, and in many instances those can have a profound anti-inflammatory effect. My preference, like any time, is to rely on real whole foods as your supplements and not necessarily a pill. But I live in the real world, and I understand that sometimes we don't eat as we should. So sometimes the supplements help to overcome what we call our SAD, SAD, our standard American diet. So eat more fruits and vegetables, obviously. Other anti-inflammatory foods are things like grapes. Most fruits with the skin on them are very, very helpful because the skin contains a bunch of antioxidants, which can be very, very helpful. Celery, blueberries, garlic. Garlic is also somewhat of an antibacterial herb, which can actually have some beneficial effects. Olive oil by far should be your main cooking oil. It's by far the most healthy of the oils. A lot of teas, especially green teas, have shown to have some anti-inflammatory benefits. Some spices that are well known that are used, anti-inflammatory spices like ginger and rosemary and turmeric. Many of you are familiar with that. Here's one that I know you're going to like: dark chocolate. Yeah, dark chocolate. Yeah, not only does it taste great, but it has some benefits. Now, that doesn't mean you need to go out and eat 6 pounds of dark chocolate saying, hey, I'm just getting my antioxidants. No, everything in moderation, nothing in excess. Ideally, you want to get about 72% or above in cacao content, and that does increase the bitterness. And I'm not talking about, Nestle's milk chocolate. That's a little different. That's laden full of sugar. So the dark chocolate heavily with cacao is beneficial. Melatonin has some anti-inflammatory properties as well as its sleep benefit. Berberine is an herb that's been used for help to stabilize blood sugars, and it does have some anti-inflammatory properties. Beetroot juice extract. You've seen probably some ads in the last few weeks to months about beet products. Well, indeed, there's some evidence that beetroot extract does have some anti-inflammatory beneficial properties. I mentioned turmeric and, of course, the omega-3 fatty acids that are contained in many fish oils. Be a critical consumer. Do your homework. Don't just walk into a place and pick something off the shelf because you don't know the quality. One of the real benefits, I think, if you're geared towards this approach is that's something that I've been interested in many, many years and have several resources that you may or may not have to your availability that I can provide and give you some advice on various herbs that are scientifically valid and supplements that are proven in empiric studies. We have a wealth of information now that we just don't have to rely on anecdotal evidence anymore. Now, what are some inflammatory inducing foods? A lot of these that you already know. These are things like red meat that have a high saturated fat content. Now, again, everything in moderation. I'm not saying stay away from these foods. I'm just saying understand that they have to be consumed in moderation, and you don't want to overdo it. What does overdo it mean? Well, maybe 1 or 2 servings a week. Anything with trans fats, we know that now. Trans fats make up a lot of the fat that's contained in processed cookies and cakes, and luckily they've taken a lot of the trans fats out of the fast foods. Even now, they don't cook with the oils that contain the trans fats, but there's still plenty of them around, so you've got to be an active label reader to determine if something has trans fats in it. Put it back. It's not good for you. You're just basically eating poison. And you want to stay away from things like margarine and corn oil and obviously deep fried foods. Unfortunately, we live in the fried belt, and that's probably another reason why Mississippi, Alabama, Georgia, and Tennessee have the highest rates of obesity in the country. I can remember years ago growing up, and I would hear in the house all the time, if it ain't fried, it ain't food. Well, that's part of the culture. But we've just got to be smart about it. And just processed foods. If it's something that you don't recognize, that if you it's the farther away from where it originates, the more processed it is, the more nutrient lacking it becomes, and usually full of other bad things. Sleep is probably one of your best anti-inflammatory drugs on the market. I know that sounds kind of bizarre. You take one a day and it just takes 8 hours to swallow. But there's no question that adequate rest creates a or an anti-inflammatory state. Too little rest, and what do I mean by that? Less than 6 hours. Oh my God, did I just really make some people mad? Because 70% of folks in the country have a sleep problem with regards to the quantity and quality of sleep. And we define that by less than 6 hours of quality sleep a night. So we know how critically important that is in supporting the immune system. People who get inadequate rest almost universally have elevations in the markers of total body inflammation. So the flip of that is equally as important, and that's that getting restful sleep reduces that in many ways almost back to normal. The other caveat is exercise. Am I starting to sound like a broken record when I talk about these things because they seem to always be the things I bring up? Well, there's a reason, because it's true. Just because somebody says the sun is going to rise tomorrow and it says that every day for the next 30 days doesn't make it any less true. You're sick of hearing it, but it's still true. And the same things I keep repeating over and over because they are true. And I'll keep repeating them until we get everybody doing them. It's that simple. But being active, now how do I define being active? Well, about 2 hours total, 2.5 hours total of exercise during the week. That's about 30 minutes a day, a brisk walk where you get your heart rate elevated. Also, just being active in your daily life. When you're in the office and we're talking about things, I try to make the distinction between exercise and just being active. And being active in your daily life, like taking stairs, parking farther away, standing up when you could be sitting, all that makes a big difference too. One of the best tools for reducing total body inflammation is being active. We know that being overweight is absolutely one of the most common hyperinflammatory states. Somebody could be doing everything right, but if they're 20, 25 pounds overweight, because the fatty tissue, the excess fatty tissue, is incredibly pro-inflammatory, they will have many of the problems secondary to the inflammation, and it's not necessarily the weight, it's the inflammation that comes from the excess body fat. And so losing 10 to 15% of your body weight, especially if it's body fat, can dramatically reduce your inflammation. That's why so many of these chronic illnesses like diabetes and hypertension and cancers and senile dementia all are positively associated with being overweight. And we feel like a lot of that is not due to the anatomical bulk of the fatty tissue. It's to the change in the metabolic state of the body, the change in the inflammation of the body, because the fat cells are incredibly hormonally active and they're constantly producing these inflammatory chemicals. That's why we really talk so much whenever we're talking about getting healthy and staying healthy, and that's not necessarily losing weight, but it's losing body fat to get into a healthy place. And that's the reason why. Stress, an incredible pro-inflammatory generator. Anyone who is under chronic stress, and who isn't these days, creates a hypercortisol production by the adrenal glands. Cortisol is a hormone that normally is there to help us in fight or flight situations like adrenaline is, or norepinephrine. But when it's produced chronically, when you chronically are upset by you hate your job, or you're having relationship issues, or you're just a nervous, anxious person, then that sets up a chronic inflammatory state. So learning stress management, that's another thing that we spend a lot of time in the office. There's been some estimates that up to 70% of doctor visits are secondary to stress and anxiety. So it's not imagined, it's real. It creates a complete change in your physiology, and we have to address that. And there are some proven stress management techniques, whether it's prayerful meditation or exercise or deep breathing or Tai Chi or yoga or listening to music or reading. And we even have some apps now that we suggest, and we have some biofeedback techniques that we can use to help with stress. So there's a number of things we can do to help with that, and it's something that we don't want to forget about, because it's at the core of hyper-inflammatory issues. One area that might surprise you that's very important and gaining in importance is good dental health. We understand now that people who have poor dental health, whether it's gum disease or tooth decay or any kind of oral lesions, that can produce a chronic inflammatory state. So we always are recommending now, as part of our exams, being sure that you're getting good dental care and making sure that you've not got any chronic underlying infections, which is essentially what gingivitis and those types of things are, and not showering your system constantly with these inflammatory chemicals. So you've got to pay attention to good dental care. And then I'll end on a positive note for some of you. We know that too much alcohol creates a lot of damage, just in not only in the liver, but it also creates a hyperinflammatory state. However, the studies are pretty conclusive that moderate alcohol intake may actually have an anti-inflammatory. I always have to give a caveat when I say that is, no, I'm not saying go out and have 4 or 5 glasses of wine a night. That's not what I'm saying. But generally the studies, and here we're going to do what our politicians tell us to, stick to the science. Well, the science says that for men, 2 glasses of wine an evening or a day, and for women 1, because they do metabolize it differently, can have some slight anti-inflammatory effects due to some of the chemicals contained, but moderation is the key. So there's my quick primer on inflammation. I hope that's given you some practical pointers to begin to utilize in your life. We'll reinforce this and stress this whenever we get together in the office. Remember, I'm available anytime you have any concerns or problems. We're now in our new private satellite office, and those who have been there have been real excited about it and been real pleased. It's over on Central Avenue, 2315 Central Avenue. So we're excited to see you whenever you have a need for us. We're there to help you and take care of any immediate needs. And then, of course, we're also still scheduling the annual wellness exams, and we're purposefully spacing those out. So don't be upset or bothered if you're not scheduled to come in until the summer for your annual wellness exam. We purposefully are trying to have several touch points throughout the year so that we can communicate and get together several times. So, and just know that if you're not scheduled for that annual wellness exam until later, we're still here. We're still available to you. And if you have any concerns or problems or questions, or you just need to talk about something regarding your health, we're here for you all the time. So you're not limited to that annual wellness exam by any stretch. If you haven't activated your MDVIP patient portal, please do. That's another tool for us to communicate. Very simple to do. Just go on mdvip.com and click the login button, and it'll help walk you through getting that active. So there's going to be a lot of resources available on that, and it's also a way that we can communicate that in a HIPAA compliant format so we can actually communicate about medical issues in a safe environment. So until next time, make healthy choices. See you soon.